Diabetes is not only a disease that damages your heart, but also increases your risk of heart failure. ABC 7's Alex Redmond joins us now with more on the findings of a newly published study. Alex?
That's right, Scott. Research published in the Journal of the American College of Cardiology finds if you avoid diabetes, you're far less likely to experience heart failure in later years.
I have type 1 diabetes. It was 1987. So I've been diabetic for 25 years?
Certified medical assistant Vanessa Stralnick says diabetes may affect her health in the long run.
My life expectancy could be short. I've heard that it could be anywhere from 15 to 20 years shorter than the normal person that doesn't have the diabetes.
Almost 70% of patients with diabetes, age 65 or older, die of some form of heart disease.
Kathy Dart of Northport has type 2 diabetes.
Since I was recently diagnosed, I really hadn't been concerned with it until, I guess, now.
If you are diabetic, you have anywhere from a 2 to 4-fold increased risk of dying from heart disease versus a person without diabetes.
We know that there's a link between diabetes and heart disease, but now research finds that you may have longer before heart failure if you're not diabetic.
People without diabetes developed heart failure 8 to 10 years later than people with diabetes.
The U.S. Centers for Disease Control and Prevention says about half of those who develop heart failure will die within 5 years. Now, a Northwestern University study of 3 heart risk factors finds diabetes appeared to have the greatest effect.
Diet and exercise has a tremendous impact in your risk of developing diabetes, high blood pressure, heart disease, which then plays into a reduction in the risk of heart failure.
I have heard that you can get type 2 diabetes under control and can eliminate it. Since I've been on the medication, my numbers are actually starting to drop.
Stralnick also advocates healthy lifestyle choices.
That's why, I encourage myself to exercise and eat right for that reason.
Dr. Naluri says adopting a healthy lifestyle, including exercise and eating foods like those of the Mediterranean diet, are among the most important things that you can do to lower your risk of developing cardiovascular disease and type 2 diabetes.